Okay, picture this. A horse, perfectly healthy, thriving even, and then suddenly, seemingly out of nowhere, it's hit by this absolutely devastating illness.
Right.
Within just a few days, it goes from totally fine to, well, severe liver failure.
Mm.
And the outcome, often tragic. This
Hmm.
isn't some super obscure thing either. It's a condition called Theiler disease, and it's known for being mysterious and incredibly fast-moving.
Yeah, it's definitely challenging.
So, welcome to the deep dive. This is where we, take a whole pile of research, articles, notes, and basically boil it all down to the really important stuff for you.
Get right to the core of it.
Exactly. Today, our mission is to navigate the complexities of Theiler disease. We're going to unpack its causes, which were a mystery for a long time, look at the really dramatic signs, how vets diagnose it, the massive challenges in treating it, and what we know about preventing it.
Think of it as your shortcut.
Yes.
Yeah.
Your shortcut to being properly informed on something pretty complex. We've got some surprising facts and insights that'll help you really grasp what's going on with this disease.
And what makes Theiler disease so interesting for a deep dive like this is, well, how much our understanding has changed. It's evolved dramatically over the years.
Right.
For such a long time, it was just this medical puzzle.
Yeah.
And now we're actually seeing breakthroughs in figuring out where it comes from. It's a perfect example of how science works, really.
Okay, so we've painted a picture of how serious this is, but let's dig into what Theiler disease actually is.
Yeah.
Beyond just mysterious illness.
Yeah, the basics.
So it's also known by a few other names: acute hepatitis, serum hepatitis, idiopathic acute hepatitis, even serum sickness. But basically, it's characterized by acute liver failure, often fulminant, meaning really severe and sudden, and something called hepatic encephalopathy in adult horses.
Which is the brain being affected by the liver failure.
Exactly. It's just a sudden, major attack on the liver.
And what's interesting is that while the signs are pretty consistent once it kicks in, there seem to be these 3 different ways it tends to show up. Historically, that just added to the mystery.
Okay, what are those patterns?
Well, first, you've got horses that got some kind of equine blood product, like tetanus antitoxin, maybe 4 to 10 weeks before they got sick. That was a big clue.
Oh, okay.
Second, you sometimes see horses that didn't get the product themselves, but they were around a horse that did get it and got sick. Contact cases.
Indirect exposure?
Right. And then the third one, maybe the most puzzling for a long time, involves horses, often brood mares, out on pasture in the fall, with absolutely no known history of getting any blood products.
None at all.
None that anyone knows of. And sometimes these cases pop up as outbreaks on a farm. So you can see why figuring out the cause was so tough.
Definitely. Those patterns really highlight the enigma. So once it hits, you said the signs are alarming. How quickly does it happen?
Oh, it's incredibly fast. The onset is usually sudden, and sadly, death can occur within just 2 to 6 days.
Wow.
You see the classic signs like jaundice or icterus, that yellowing of the gums, the eyes, and the urine often turns really dark because of bilirubin.
Oh.
But the neurological stuff, the hepatic encephalopathy, or HE, that's often the most striking and, frankly, scary part.
Yeah, you mentioned that. What kind of neurological signs are we talking about?
It's a whole range, really. It can be mild depression, or the horse might just stand there pressing its head against a wall or fence.
Head pressing, okay.
Yeah, or circling in the stall, being unsteady on their feet, that's ataxia. Sometimes acute blindness, or just wandering aimlessly. Frequent yawning is another sign people report.
Yawning? That's interesting.
It is. And then in severe cases, it can escalate to, mania, aggression, seizures, or even coma.
That sounds terrifying.
It is. And what's really telling, under the microscope after death, they find specific changes in the brain cells called Alzheimer type 2 astrocytes. It just shows how severely the liver failure messes with the brain.
Man, that really drives home the severity. Are there other disturbing signs people might see?
Yeah, definitely. Sometimes you get hemolysis, that's red blood cells breaking down, and hemoglobinuria, which is hemoglobin in the urine. Both of those, unfortunately, usually mean the prognosis is worse.
Not good signs.
Not at all. You can also see photosensitivity skin getting lesions from sunlight, especially in light-skinned areas, and abdominal, like colic symptoms.
Okay.
And the liver itself, at necropsy, it's often described as small, limp, almost like a dish rag. Just totally reflects that massive cell death that's happened. It's a grim picture.
A dish rag liver. Wow. Okay, let's shift gears a bit. You mentioned the cause was a mystery. What's the breakthrough there?
So for the longest time, like you said, it was often just called idiopathic, cause unknown. But that's changed dramatically.
Right.
There's now really strong evidence linking Theiler disease to a specific virus, equine parvovirus hepatitis, or EQPVH for short.
EQPVH. Okay.
Yeah.
Yeah.
And it's what we call hepatotropic virus, meaning it specifically targets the liver cells. That's its main goal.
So it goes right for the liver.
Exactly. And this discovery, it's huge. It took this mysterious idiopathic disease and gave it a clear viral suspect. That fundamentally changes how we think about diagnosis and hopefully prevention down the line.
That is a massive step forward. Is EQPVH the only virus they're looking at, or are there others in the mix?
Good question. EQPVH is definitely the main player based on current evidence. But research is also investigating other potential viruses like NPHV, TDAV, EPGV.
Okay.
What's interesting about those is they belong to the Flaviridae family. And that family includes the virus that causes hepatitis C in humans.
Oh, wow. So there's a connection there, sort of.
Yeah, a family connection, which is scientifically interesting. And this viral link also helps explain that first pattern we talked about, the link to equine blood products.
Right, the tetanus antitoxin and things like that.
Exactly. Tetanus antitoxin, botulinum antitoxin, plasma. If those products were contaminated with the virus and given to a horse, you could see disease pop up 4 to 10 weeks later. That points to iatrogenic transmission.
Meaning caused by the treatment itself.
Precisely. Inadvertently.
But what about those other cases? The ones not linked to blood products? How does the virus explain those?
That's the million-dollar question, isn't it? The fact that we see cases without that biologic link suggests there must be other ways the virus spreads.
Like what?
Well, researchers are looking into things like oral or nasal shedding of the virus, maybe fecal-oral transmission, or even insects acting as vectors, carrying it from horse to horse.
So like mosquitoes or flies?
Potentially. These routes are still under investigation. It really raises an important question about the ongoing risk, even for horses that haven't had any recent biologics. It tells us we don't have the full picture quite yet.
Yeah, definitely more to uncover there. So, okay, a vet suspects Theiler's. How do they actually go about diagnosing it? It sounds complex.
It is. It's usually a combination of things. The horse's history is key, especially that 4 to 10 week window after a biologic.
But you said that's not always present.
Exactly. Its absence doesn't rule it out.
Yeah.
So then you look at the clinical signs we discussed, the jaundice, the neurological issues.
Right.
And then, crucially, the laboratory findings.
Okay, what do the lab tests show?
Serum biochemistry is huge here. You'll see really marked elevations in liver enzymes, things like AST, SDH, GLDH.
How high are we talking?
AST levels can skyrocket, often way past 2,000 IUL. And if they hit over 4,000, that's generally considered a very poor prognostic sign, a real red flag.
Okay, got it.
You also see high bilirubin levels, both types, conjugated and unconjugated. Serum bile acids go up, and ammonia levels in the blood, the hyperammonemia, that correlates directly with how bad the neurological signs are.
Makes sense.
You might also see low BUN blood urea nitrogen because the failing liver can't process waste properly. And maybe low blood sugar, hypoglycemia.
Wow, it affects a lot of parameters.
It really does. There's also neat little point-of-care tests. Some vets use the green bubble test.
Green bubbles.
Yeah. If you shake up a urine sample from a horse with severe liver failure, the bubbles will look green because of all the bilirubin in the urine. It's a quick visual clue. And then you look at clotting. The prothrombin time, PT, and activated partial thromboplastin time, APTT, will likely be prolonged. The blood isn't clotting normally.
Which could lead to bleeding problems.
Exactly. And finally, you can do specific PCR testing for EQPVH and those other viruses we mentioned. This is often more for research or confirmation.
Okay.
Interestingly, the amount of virus in the blood, the viremia, usually peaks around 5 weeks after infection. But the actual hepatitis, the liver inflammation, tends to kick in when the horse starts making antibodies. That's called seroconversion. It helps track the disease timeline.
So the immune response might actually trigger the worst part.
It seems linked, yeah. And while a liver biopsy is the definitive way to diagnose by showing the actual cell damage, it might not always be done in a classic case if it won't change the treatment plan anyway.
Right, if the picture is already pretty clear. Okay, so the diagnosis paints this picture of severe rapid damage. Treatment sounds like, well, like a real uphill battle.
It absolutely is.
What can actually be done for a horse with Theiler's? You said there's no specific antiviral.
That's right. No magic bullet against the virus itself. So the entire focus is on intensive supportive care, trying to manage the symptoms and keep the horse going. This often means ICU-level care.
Okay, so what are the main goals of that supportive care?
Number 1 is managing the hepatic encephalopathy, the brain issues. The goal is to reduce the toxins coming from the gut, especially ammonia.
How do you do that?
Medications like lactulose can help, Metronidazole or neomycin, which are antibiotics, can reduce ammonia-producing bacteria in the gut. But there's a big caution with neomycin. Yeah,
Oh,
you really shouldn't give it for more than about 24 to 36 hours because it can cause really severe diarrhea, which just adds another huge problem.
okay, good to know. What about sedation for the neurological signs?
It's a delicate balance. Sedation can help keep a distressed horse from hurting itself, but too much sedation can actually make brain swelling, cerebral edema, worse. So it has to be
Yeah.
managed very carefully.
Tricky. What else?
Fluid therapy is vital.
Mm.
Intravenous fluids to correct dehydration and electrolyte imbalances, and nutritional support is key. If the horse is still eating, the diet needs to be specific. High in carbohydrates, low in protein,
Why low protein?
because protein breakdown produces ammonia, which the failing liver can't handle. So you want easily digestible carbs.
Yeah.
Think palatable grass hay, maybe small amounts of feeds like sorghum or soaked beet pulp. Some vets use commercial paste with branched-chain amino acids too. And if blood sugar is low, they'll need dextrose-free V.
Makes sense. So managing the brain, providing fluids, and the right nutrition.
Yep.
Are there other supportive therapies vets might use?
Yes, absolutely. Anti-inflammatory drugs like pentoxifylline can help reduce systemic inflammation. Antimicrobials, maybe something like ceftiofur, are often given to prevent bacteria leaking from the damaged gut into the bloodstream. That's called bacterial translocation, a common risk.
Okay.
And then there are antioxidants, things like acetylcysteine, same as adenosylmethionine, or silymarin, which comes from milk thistle. The idea is to help protect the remaining liver cells and support their function.
Lots of different angles there. Are there things that should absolutely not be done? Contraindications.
Well, besides the oversedation risk we mentioned, it's generally recommended to give oral meds using a dose syringe rather than passing a nasogastric tube, if possible.
Why is that?
Because putting a tube down can sometimes cause nosebleed. If the horse swallows that blood, the protein gets digested and increases ammonia levels, making the HE worse.
Ah, okay. Subtle but important.
Definitely. And one more thing, because the liver is so crucial for metabolizing drugs, many medications will last much longer in the system of a horse with liver failure. Dosages and frequencies often need careful adjustments.
Right. The liver's not clearing them out properly. So with all this intensive care, what does it mean for the horse's chances? What's the bottom line for recovery? So what for our listeners?
Yeah, the prognosis, well, it's typically guarded to poor. Unfortunately, the mortality rates reported are high, often somewhere between 50% and maybe even up to 90% for horses that show clinical signs.
Wow, 50 to 90%, that's incredibly high.
It is. There are definitely signs that point towards a worse outcome. Things like really rapid progression of the disease, severe HE that can't be controlled, any significant bleeding problems, severe low blood sugar, and those super high liver enzymes, especially AST over 4,000.
Okay, those are the bad signs. Are there any good signs, indicators that maybe a horse will pull through?
Yes, thankfully. Horses that manage to stay stable, maybe keep eating, even small amounts, for about 3 to 5 days. That's often a positive sign. Also, seeing certain liver enzymes like SDH start to decrease and seeing the clotting times like the PT begin to normalize those suggests the liver might be starting to recover.
So there are glimmers of hope.
There are. And here's something truly remarkable. If a horse does survive the acute crisis, the long-term prognosis is generally good.
Really? After all that damage?
Yes,
Hmm.
because the liver has this incredible, almost unique capacity to regenerate. Unlike a lot of other organs, it can actually heal and regrow significantly, provided it gets through that initial massive insult.
That's amazing. A real testament to the body's resilience.
It really is.
Yeah.
But it underscores why surviving that first critical phase is so difficult.
Absolutely. Which brings us to prevention. Given how devastating this is and that amazing regenerative capacity might not get a chance, how do we minimize the risk? Especially now we know about the virus, EQPVH.
Prevention really hinges on minimizing exposure to EQPVH. That's the key.
So how do we do that?
A major point is being really careful with equine origin biologics, those blood products. The recommendation is to use commercial products that are licensed by USDA, APAQS, and crucially have been tested and shown to be negative for EQPVH.
Okay, so look for tested products.
Definitely.
Right.
It's worth having a conversation with your vet about the risks versus the benefits of using any biologic, and maybe considering autogenous products, those made from the horse's own blood, if that's an option.
Right. What else?
Basic biosecurity becomes really important too. If you have an affected horse, isolation is key because they might be shedding the virus. And strict hygiene. when handling anything contaminated with blood or tissues, needles, syringes, dental equipment, even things like stomach tubes, using them properly,
Yeah.
not sharing without sterilization, that kind of thing. It sounds basic, but it's crucial for preventing spread.
Good hygiene fundamentals.
Exactly. And, what's fascinating is that research is still ongoing to fully understand how EQ-PVH spreads, especially those non-biologic routes we talked about, oral, nasal, insects.
Right.
Figuring those out could give us even more prevention strategies down the road. But for now, it's important people know there isn't a vaccine available for EQ-PVH.
No vaccine currently.
Not yet.
Wow. Well, we've certainly taken quite a journey through Theiler disease today. From that mysterious sudden onset through the scientific detective work, identifying the virus, and looking at the really intense challenges of treatment,
Yeah.
it truly highlights just how complex and scary acute liver failure can be in horses and how quickly things can go wrong.
It really does.
Me.
And if you zoom out, look at the bigger picture, this whole story is a fantastic example of how science evolves, right? What used to be just labeled idiopathic cause unknown can become something with a clear, identifiable cause thanks to persistent research.
Yeah.
And it kind of raises an important question, doesn't it? How many other unexplained illnesses out there, in horses, in humans, everywhere, might just be waiting for their own EQ-PVH moment? Waiting for that viral cause to be discovered. It could totally transform how we approach them, just like it's starting to for Theiler disease.
That is a really powerful thought to end on. It makes you wonder, so for you listening, what stands out most about how quickly our understanding can shift for a disease like this, and maybe how that perspective applies to other things you're curious about? Keep that curiosity going and keep doing your own deep dives into whatever sparks your interest.